Hi friends, now I will explain facial nerve lesions and how to identify the lesion and where how we will identify the where is the lesion. Now I will explain that. Before going to that, I will explain the pathway. Uh, if we know pathway, then only we can identify where is the lesion. So now I will explain the pathway first. Then I will go to the lesions and how to identify. Pathway. First, it started the brainstem. There is brainstem. There are seventh nerve nuclei, and beside there is a sixth nerve nuclei, and above that there is a salivatory nucleus and lacrimatory nucleus, and below of these there is a tractus solitarius. Uh, this is the tractus solitarius, which receive the taste from the tongue. These are converge to form a seventh nerve and emerge out through the internal auditory meatus. From here, they form the geniculate body near the middle ear. At the geniculate body, it gives the branch. It is called greater petrosal nerve. This nerve is for the lacrimation. This is geniculate ganglion. Below the geniculate ganglion, uh, in the middle ear, while going through the posterior wall of the middle ear, it gives a branch to the stapedius muscle. It is called nerve to stapedius. And after that, uh, it enters into the middle ear cavity, forms a cord-like structure. So it is called carda tympani. From there, it goes through the linguinal nerve. It supplies the anterior tooth of the tongue, and it supplies the sublingual and submandibular glands. From two-third anterior part of the tongue takes the taste sensations and to the tractus solitarius, where the taste is assessed. From uh, this now is helpful in the salivation. After that, it enters extracranial part through the stylomastoid foramen. It gives the facial branches, which is useful for the facial expression. This is the pathway of facial nerve. I will explain some interesting facts. One is, when we will see any uh, like lemon or amla, then we started we started salivation. Why? When we see these fruits, our eyes receives the image of these fruits and assess in the higher center, where the eye centers is connected with the these salivatory nucleus. So when we see the amla or lemon, these impulses goes to the higher centers, where these from that centers some fibers are connected with these nucleus, this parasympathetic nucleuses. So when we see the lemon or amla, the impulses pass through this and it will goes to the sublingual and submandibular. It started salivation. This is the mechanism. Another one, uh, small children have rooting reflex. What is rooting reflex? Rooting reflex is when we keep the one finger beside the angle of mouth, the baby started turning towards your finger. It is called rooting reflex. Why it will happen? For the suckling. Baby is searching for the suckling to drink the milk. So when we touch the when mother keeps the baby at her breast, the nipple senses the angle of the mouth. This senses goes to the hair centers. From there, it connected with the seventh nerve. So from the seventh nerve, impulses come to the facial expression. These facial muscles of the baby is useful for the suckling. This is the one fact. Another is when we have in emotional condition, like if you saw any dead case like that, your relatives, uh, this eye receives that information to the higher centers. From there it connected to the facial nerve. From here the impulses goes through the lacrimal gland. It started lacrimation. This is the one mechanism. Other other mechanism is, uh, when you observed or not, I don't know, when you shouting so much loudly, that sound is not heard by you. Why? Because when there is when you started shouting, it prevents the uh, listening that loud sound. Why? Because you started, for example, you started loud sound. It cannot bearable by the other persons, but you can bear. How it will happen? It will happen by the this mechanism only. When you started loud sound, uh, our body senses that you are shouting loud. This impulse goes to the seventh nerve. It reaches the nerve stapedius. It uh, it helps in the prevention of hyperacusis. It is the mechanism. These are the all mechanisms in this now. This is the pathway also. Next I will explain the lesions. First I will explain that upper motors, how it how our base receive the nose from cortex. First, this is the upper half of the face. This is the upper half of the face is received the contralateral side and ipsilateral side, but lower of the face is received only contralateral. So when there is upper motor lesion, it leads to the only paralysis of lower half of the face. Why? Because it receives the contralateral fibers only, but upper face both contralateral. So there is no paralysis in the upper part of the face. Same side like that only. If there is lesion in the here or here, it leads to the complete paralysis of the face. Complete paralysis of the face. Uh, one another point is, if at nucleus site there is involving of the sixth nerve also. uh, if there is sixth nerve fallacy, there is fail to adduct the eye. Abduct the eye. First I will explain facial nerve palsy symptoms to identify the lesion. First is loss of lacrimation, loss of stapedial reflex, loss of taste from anterior two-thirds of the tongue. Another one is lack of salivation. Another one, muscles of facial expression. It is also called Bell's palsy. First, if there is here if there is lesion here, you lose all things: loss of lacrimation, loss of staphydial reflex, and loss of taste, and loss of salivation, and loss of facial expression. These five only I wrote in that page, all five things. Now we say, if there is here lesion, you have all four, five. If there here lesion, what you will have? You have only it is going here. No, if there is lesion here, you have remaining four. If here lesion, you have 3, 4, 5. If there is lesion here, fifth one you have symptoms. This is the lesions and their symptoms. That one only written here. Patient came with 1 to 5 symptoms. Is suspected above the geniculate ganglion there is a lesion. If patient came with 2, 3, 4, 5, lesion below the geniculate ganglion. 3, 4, 5 symptoms, lesion above the chorda tympani. Only fifth symptom you see on below the stylomastoid foramen. These are the lesions and identification of the lesions. This is the how to identify the upper motor lesions and lower motor lesions. One important point is, if there is lesion here, we can see the opposite body weakness. Why? Because there are many fibers, motor fiber descending tracts are coming through this pathway. So if there is lesion, the body is also affected. That's it. This is about facial nerve lesions. Thank you for patience listening.